Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Segmental Scruples edition or series. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Robotics, and this audio podcast as part of a Storm Robotics production. So, in this audio podcast, a little bit around, a little bit in around, a little bit in around sort of our sort of looking at why consider renal health in all patients and sort of in all patients and when all patients is in around sort of the at sort of population level. So this is actually a very important question that all scientists or specialists in transfusion care or in transfusion practices should be asking sort of routinely, considering the renal health and blood physiology of patients or recipients who may require RBTs prospectively is sort of main to achieve is sort of main to achieving best practices more so now than ever, not least because CKD, chronic kidney disease prevalence or incidences have been are increasing, but also because transfusing patients with a reduced EGFR or estimated glomerular filtration rate on renal function, all patients with chronic illnesses or long-standing conditions, or long-term conditions can further compromise renal function over time. So with renal function decline, this has an important this has an important this has a sort of an impact on overall treatment and care plans. So patients then potentially becoming becoming sort of untransfusible. So at the same time, a little bit around in around in around some data looking at looking at sort of the looking at CKD, chronic kidney disease stages, and sort of looking at some underlying data in around CKD at sort of primary care at sort of primary care sort of level. So a practice of 10,000, for example, a practice of 10,000. Sort of a primary care sort of practice of 10,000 patient sort of service users or patients will have at least 500 around 500 patients with CKD in CKD stages 3 to 5, with approximately 15 to 20 of these in CKD stage 4, and then around 10 patients or recipients in CKD stage 5. A more elderly and more deprived practice population are likely or probable to have a higher incidences or prevalence. Of the 500 with stage in CKD stage 3, CKD stage 3, 84% 84% will have CKD stage 3A, and 16% will have CKD stage 3B. About 90% of patients or recipients with CKD stage 3 through 5 will have sort of primary other sort of additional primary health conditions. So 40%, for example, will have vascular complications. 30%, 30% will fall in the category with other sort of comorbidities. Full details also the sort of the incidences and prevalences of CKD stages 3 to 5 have been sort of documented and evidenced in, for example, works by the UK Renal Registry, for example, UKRR, and also in other sort of in other epidemiological investigations. So patients with CKD stage with patients with CKD CKD or chronic kidney disease are roughly 20 times more probable to die from sort of from cardiovascular than progress into ESRD or end stage renal disease. And so the all causes mortality rate in CKD is 30 to 60 times higher than in the general population. And so scientists again and clinical teams now need to question what are the sort of clinical implications for transfusing and the decisions required or needed to transfuse safely, if at all. That draws this audio podcast to a close. This has been an audio podcast as part of the Segmental Scruples series or edition. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production.